The Minitab Healthcare module will help us to improve our healthcare operation by assessing and showing improvement in healthcare-specific key performance indicators. In this video, we specifically focus on patient safety key performance indicators. At the end of the video, we will look at hospital-acquired infections, but first, we will be analyzing patient falls. We will use the Healthcare module and navigate to the section of the Healthcare module on patient safety, where we will select the Patient Falls option. We will first use visualizations to understand the current state of our operation regarding patient falls. To do this, we will select the Visualize Patient Falls option that will show the tools available to visualize patient falls. Visualizations can help us to summarize our data and better understand its key characteristics, such as the median, range, and if there are any unusual patient fall rates in our data. To do this, we will select the Visualize the Median and Range of Patient Fall Rates and Identify Unusual Patient Fall Rates option, which will give us a box plot. We will then make sure our Patient Falls column is populated in the dialog box, and we'll select OK. And Minitab will return our box plot. This box plot displays insights we may not see from looking at our raw data. The graph shows that the median number of patient falls is 6. We also see that patient falls range from 3 falls to 13 falls. There also appears to be an outlier or unusual observation for number of falls, and this is denoted by the star-like point at 13 falls. In our data, we also have a column of reasons why each patient fall occurred. We will use this column to visualize the most commonly occurring reasons for patient falls. To do this, we will return to the Healthcare module, back to the Patient Falls option, back to the Visualize Patient Falls option, and this time selecting the Visualize the Common Reasons for Patient Falls option that leads us to a Pareto chart. We then make sure we have our column of reasons for patient falls populated in the defects or attribute data box. And then we select OK to return our Pareto chart. A Pareto chart is a tool that will allow us to easily identify the most frequently occurring reasons for patient falls. We see in this Pareto that the reason for more than 50% of falls was the bed exit alarm not being set. This was followed by no call for assistance being the second most commonly occurring reason, a bit more than 25% of the time. In this case, the Pareto displays that improvement efforts likely should be focused on making sure bed exit alarms are set for patients. We can see that doing a better job of setting our bed exit alarms is a potential area to reduce patient falls and increase patient safety. Now let's assume we have instituted a process change centered around making sure bed exit alarms are set. We can then return to the Healthcare module to demonstrate and verify that the process change surrounding bed exit alarms resulted in a statistically significant decrease in patient falls. To do this, we select the Decrease Patient Falls option, where we will compare falls before the process improvement to falls after the process improvement by selecting the Demonstrate that the rate of patient falls decreases after a process improvement option. We can select this information icon for more context surrounding this specific analysis type in the Minitab Healthcare module. After some more context, we're ready to complete our analysis. Here, we'll enter a column of patient falls, the number of opportunities for occurrence, and then the stage column representing whether the time is associated with before or after the process improvement. In options, we'll select the less than hypothesis to test whether there was a decrease in patient falls after the process improvement. Because the p-value here is less than 0.05, we can conclude that we have successfully reduced patient falls. The Minitab Healthcare module helped us to successfully accomplish this task of reducing patient falls and increasing patient safety. The patient safety section of the healthcare module can also help us to monitor hospital-acquired infections. In our Minitab worksheet, we have a column of dates and times at which hospital-acquired infections occurred. To monitor these, we will select the hospital-acquired infections option, and then we'll select the analyze the time between hospital-acquired infections using control limits. Then we'll make sure we have our date and time column populated in the variables box, and we'll hit OK. The T-chart allows us to monitor the time between rare events, such as hospital-acquired infections. Each point represents the number of days between infections. The chart helps us to understand whether infections are in or out of control. In this example, there appears to be one out-of-control point in red that could be a concerning trend in infections that should be investigated further. This is another example of how the Minitab Healthcare module helps us to monitor and improve patient safety. Thanks for following along with me. I hope this short video gives you an idea of how analytics in the Minitab Healthcare module can be an asset in keeping your patients safe.